Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and today I am here with my most non-excessive skinned, eyelided co-host to talk about blepharoplasty, Dr. Millicent Ravello.
Good evening. How are you?
I'm good, and I noticed that you do not need blepharoplasty anymore.
Anymore, because I had one. So therefore, I will speak to this as a patient and a doctor.
Yes, I will talk to you as a patient also because I need blepharoplasty. Something awful.
As a prospective patient.
It's not even prospective. Like, it's an emergency. We should go to the OR immediately following this podcast and take care of it. Please.
So blepharoplasty is a procedure for the skin of the eyelids. This is part of our 101 series where we're just really trying to hit the basics in a very basic, short and sweet manner. We struggle with that sometimes because we take detours, but we're going to really try and just hit the sweet spots here on blepharoplasties. And blepharoplasties is basically surgery of the eyelid. And this can be the upper eyelid or it can be the lower eyelid. So let's just jump right into it and talk about the upper eyelid.
The upper eyelid's pretty straightforward. The technical term for needing a blepharoplasty is really dermatochalasis. It's the diagnoses we made that say, oh boy, there's excess skin, needs to come off. There can be hooding. There can be brow ptosis. That's all involved in upper lid blepharoplasty. That has to be considered. Especially, I typically don't like to consider just doing eyelid surgery without the brow.
Right. Because usually it goes hand in hand. If you are at a stage or an age where you have developed excess skin of your upper eyelids, you've probably also developed some degree of eyebrow ptosis, which just means that the eyebrows now sit a little bit lower on the forehead. And so together, the low position of the eyebrows with the excess skin of the upper eyelid just sort of closes off the upper eye and makes the eye appear smaller. And a lot of times these patients, you can diagnose them depending on their level of Botox because they are constantly activating their forehead muscles to raise their eyebrows up or to get that extra skin off their eyes so they can actually see. So they're constantly contracting their forehead muscles to raise their eyebrows just to open up their eyes. And if you only address the eyelid skin, and say you take the eyelid skin that's extra, but you don't do anything with the upper brow, the brow can drop even lower because now the forehead doesn't have to work as hard to open up the eyes so that you can see. And so the brows now drop even lower on your forehead. And now you just look like you're mad all the time.
Yeah, because it does. I mean, that's the bottom line is that when you take skin out of the upper eyelid, it's going to recruit that skin from somewhere. So typically it brings the brow down. Right. And I've seen this in people who just get their eyes done, quote unquote. Mm-hmm. Doing the brow is really important. So a brow lift with the upper blepharoplasty, plus or minus some fat excision from the fat pockets of the upper eyelid. There's, I typically take some fat out of the medial and middle fat pads.
Right,
I don't typically go underneath the orbicularis oculi muscle and take out what's called the SOOF, the orbicularis oculi fat pad that's underneath the muscle.
Well, there's no need to. There's no need to. That'll give you that very kind of hollowed out Skeletor look, which had a moment, I think, maybe back in the 80s and 90s. But we've learned that by doing that, you tend to actually age the eyelid area, and that's not what we're trying to do. We're trying to make it rejuvenated. So minimal fat removal. Most people have a little bit of excess right in the corner of their upper eyelid that's safe to take, but getting too aggressive with the fat removal is just not necessary.
It's not cute.
And it's not,
it doesn't look good.
Cute. You don't need it. But one of the things that's really important when you're going in for your upper lid blepharoplasty evaluation is there's a few things you do have to rule out to make sure are not also contributing to your eyelid problems. And one of them is just ptosis of the actual eyelid itself.
It's a very big word.
Ptosis, ptosis, ptosis.
Which means drooping of the lid.
Sagging.
That is due to other factors than just having some excess skin. There's actually a weakness or an excess of the muscle that raises the eyelid, or a weakness of kind of the complex interaction of those muscles and tendons of the upper eyelid. that can cause the lid to be low. And you note that because the actual eyelid margin, the lash margin, encroaches on the pupil itself. And you see that the lid is actually shading down
Right.
like over the pupil.
Right. And so that's a different problem. That's a ptosis correction. You have to resuspend the muscles, do something with the actual muscles that provide function to the eyelid. It's not just as straightforward as taking the skin off. So that's just something to know ahead of time. You have to diagnose that so that you do the right surgery for the right patient. But in someone that doesn't have any associated ptosis and it's just a straightforward excision of skin plus or minus a brow lift, that's fairly straightforward. If you're just doing the upper eyelids, say for some reason, I don't know, you don't need the brows. If you're just doing the upper eyelids, I mean, you can do that awake. You don't have to go to sleep for that. It's literally, I'm not saying you should, but
No.
you could. I would not.
Not to me. I will
Needles
take a little
around the eyeballs, not
it's
something
not
I
my
want to do
favorite.
awake.
Yeah.
But it is a very simple, straightforward procedure with minimal downtime, very fast healing. It's pretty smooth procedure. If you're adding the upper brow to that, then you are going to have to go to sleep and have a legit brow lift, which is another topic of discussion. But suffice to say, the upper eyebrows typically go together with the upper eyelids.
Definitely. Most definitely.
Yes.
On to the lower lids.
The lower lids. So this is where it gets a little more complex. This is where it gets a little crazy. Because
Yes.
just like the upper eyelids are rarely done without a brow lift, the lower lids are rarely done without something along with the cheek or a suspension or something. So the lower lids, they can have a whole range of problems. Some people have extra skin or crepey skin that they don't like. Some people have these fat bulging pockets that they don't like.
Right here, dude.
Here you go.
Right here. That's what I need. I call those festoons.
Those aren't festoons.
No, I know, but I think I'm getting them. They're on my way.
Festoons are when they're on your cheeks.
I know. It's when
Yeah.
they're close.
Are they encroaching
They're
on your
getting
cheeks?
there. I know. I'm just. It's just a matter of time. But we're gonna intervene.
We're going to intervene. We have
We're
plans.
gonna take care of this. It must be stopped before they kill somebody.
We can't have that.
No.
But what's really happening, as what Dr. Calvert is calling festoons, but it's fat. So normally the eyeball has fat that sits on the inside of the eyeball. It's contained within the eyeball complex. But over time, or just congenitally in genetics, the lining of the eyeball weakens. And so the fat that usually sits on the inside can sort of herniate or protrude through. And that's what people can see as bags under the eyes. But really, it's just this fat that's coming through this weakened orbital septum.
Do you think that it's just the orbital septum is getting weak, or is it that you've actually shrunk, that your skull and your skeleton and the bones are getting smaller, and so
that's probably true too, because we know that's a thing.
We know that happens,
yeah,
for sure. But I think it's just a lot of things, and you're just getting old. It's time to buff it up. You got to tighten things.
You got to tighten things. You got to redo it.
That's the deal. That's why we have plastic surgeons.
I know.
For God's sake. I mean, come on.
And there is a small subset of people in their 20s that have isolated fat bulging. And that's
True.
a genetic,
That's how they're
inheritable
built.
thing. That's how they're built. And in that person, all they need is to have that fat removed and boom, lower blepharoplasty done. But the average aging patient usually needs a little bit more than just that fat removal.
Some need skin.
Some need skin.
Some need skin. A skin
But
pinch.
even then, it's a pinch. I mean, it's literally a pinch, because the last thing you want to do is take too much skin away from the lower eyelid.
Yeah, because then you get what's called scleral show. The sclera is the white part of the eye. So you have the pupil. The iris is the black part that is the aperture of your camera eye, basically, and then the white part is called the sclera. Mm-hmm. And that part, if you see too much of it below the limbus, the edge of the pupil.
It should be iris and then lower lid. There should be
right.
no
There should not be white
below your iris on the lower or upper part.
And
of
so
the eyeball.
people who've gotten overly aggressive lower lid blepharoplasty with too much skin excision have what's called scleral show. And so you'll see that they almost have sad eyes.
They
It just
do.
makes them look.
They look sad.
They look very sad.
Yeah, like a little puppy.
And
Well,
they might be really happy.
They might, I know, right? But
They
look
just
sad.
look sad.
They look sad.
It's very sad.
So you
But-
got to be really, really conservative with the amount of skin you take there. And frequently, you don't even need to take skin. You can do some kind of tightening procedure of the skin.
Yes.
A chemical peel, a TCA peel, some kind of laser therapy after the surgery,
100%.
just to tighten that skin up. And that skin is so thin, it doesn't need much. It responds really well to these kind of tightening procedures. And frequently, that can be enough combined with the fat removal to really rejuvenate that lower eyelid.
Well, and if you go too far, then you pay for it. Your patient pays for it.
Oh, yeah,
Because
for sure.
they get ectropion, which is when the eyelid actually rolls out away from the globe, away from the eyeball. You can cause a lot of problems with lower lid blepharoplasty.
For sure. And the other thing that we always check before we do surgery on the lower eyelid, after a certain age or with the aging eyelid, that actual lower lid margin, the part that contains the lashes, that can become loose and weak as well. And then if you go in there and you do a surgery and you futz with it, it can sometimes fall away as well, even if you don't take any skin. And so we frequently do have to resuspend or tighten the lower lid, and that's called a canthoplasty or a canthopexy. And that's just one extra step that we have to do during our surgery to make sure that lower lid stays up and in position and does not fall down, which we don't want.
Yep. The canthus is the corner of the eye. There's a medial canthus, which is the part by your nose because it's towards the midline, medial. And then the lateral canthus is the part that we're really talking about out towards the lateral edge, to the
Towards
left
your
or
ear,
right,
yeah.
towards your ear. And if you have a weak lid, you can tighten that and make a big difference. And you can do that either with sutures or you can actually do what's called a formal canthoplasty, where we actually cut those ligaments and we resuspend them to the orbital bone, the bones of around the eye, and then those things can look really nice as well.
But not at first.
At first,
It's a
At first
little
a little tight.
odd. It's
Yeah,
a little slanted looking.
little odd looking.
People
We just-
get a little concerned.
Yeah, they do. They're like, so what's going on with my eyelids
Yeah.
here? And you just say, just relax. It's going to be okay.
Yeah, give
And they
it
are.
6 weeks and it'll be fine. Yeah.
And they'll relax and they do great and they're nice and tight then, and you have a much better look.
Right.
One thing I will say though about blepharoplasty is that I think a lot of people that get blepharoplasty and people that do blepharoplasty underestimate the complexity of these operations. I think they're very complex.
Oh, I think they're super complex. Yeah, the eyeballs and how they interact with the eyelids and the cheek and the forehead. It's a very integrated system, and you really can't treat it in isolation from the rest of the face.
Right. And that's like the classic of the guy that comes in and says, I want to just get my eyes done. And they need a facelift.
And they need a facelift.
And plus. So with this area, the upper facial area where blepharoplasty happens, when you're talking about upper lids, to me, you're talking about upper lids and brow. When you're talking about lower lids, you're talking about lower lids and some sort of cheek lift or mid facelift.
1,000%. Outside of that person, the 20-year-old that just had some fat bags, the average person coming in for aging eyelids has some kind of what we call lid cheek descent or, descent. So the junction between where your lower lid stops and your cheek begins is called the lid cheek junction. And with time and with age and with gravity, the cheek sort of falls away from the lower eye bone and you see a groove. People try and frequently fill that with fillers or fat to camouflage this groove. But really, what you just need to do is resuspend it. You got to bring that soft tissue of the cheek back up over that lower bone.
Yep,
and smooth it out.
Yeah, and so when you lift that
Right
cheek,
here.
and Dr. Ravello, you can go back to the mid facelift podcast we did, where we talked to Dr. Ravello about what this operation did for her, and it is key because if we just done the lower lids, you'd still
still
need
have a
lots
hollow.
You'd still need lots of concealer over that.
Yeah,
because
I haven't worn concealer in 2 years. It's been great. And I didn't really need a lower blepharoplasty. I didn't have bags. I didn't have extra skin. What I had was that junction, that groove, because I needed a mid-face.
Right.
Yeah.
And a lot of people need the mid face in their 30s, really.
Oh, yeah.
I mean, they just, they're sort of, baby fat teenage cheeks kind of go away in their 20s, and then by the 30s it's like, hey, I'm starting to look like a little older.
I would say the orbital area, the brow bone, the lids, the cheek, that's the first place the face really shows aging.
Yep.
So that's usually sort of the gateway into facial plastic surgery for most patients, because that's when the late 30s, early 40s, they really start to see the changes in their face in that area. So not uncommonly, someone's coming in for a, quote, lower blepharoplasty. I usually end up suggesting that we do something with the mid-face, some kind of resuspension, or even just a simple lower blepharoplasty, tucking, the muscle or suspending something just to lift that lower lid and cheek junction up and smooth it out. Otherwise, you'll still have a groove there.
And that's the whole point. You want it to look rejuvenated. So fill it in, elevate it, blend it, make it look good.
Do you do fat grafting in the lower lids?
I do not. I have been down that road, and no thank you.
Yeah, that's a tough one.
I don't like fat grafting there. If it's not perfect, it's a problem. That's the issue. And I've had to pick fat out of orbicularis oculi muscle. Like it's not good. I would prefer to use fillers any day of the week for that area.
It's a very thin skinned area. You can see any irregularities so easily. The fat is not super specific in terms of where it ends up going, so it's tricky. I would rather just do the lift or do some kind of suspension and obliterate the problem rather than trying to fill it in with something.
Yep, agreed.
That's my idea.
Surgery is better for that. It really does work. If you release that ligament on the lower lid and let that fat spill out, I make a little pre-periosteal pocket so I don't get under the periosteum, which is the thick coating of the bone. I put it above that. It just looks great.
Yeah, it just smooths everything out. And so all of these...
See? Right here. For those of you listening at home, go to the YouTube channel and check it out. You can see it there.
You can zoom in.
That's right.
And all of these procedures can be done at the same time. So it's called a quad bleph. That means we're doing 4 eyelids, 2 uppers, 2 lowers at the same time. Can definitely be done together at the same time. If you're at all thinking about doing all 4, you should do all 4 at the same time. It makes no sense to do them piecemeal.
Like 3 eyelids.
2
uppers, 1 lower.
Just 1 lower.
Just leave the left one alone. I think it's okay.
I think it'll be fine. No, but you definitely can do all of them together. You can do it with the brow. You can throw a facelift in. You can, do the whole thing, the whole shebang. It can all be done together. Right. Or you can just do the uppers, or you can just do the lowers, but whatever you need.
Yeah. So in the world of Hollywood, a lot of times I'll do this one 6-month period or 1 year and do this as the other part. So that especially
this
for
being,
the upper.
The listeners.
Yeah. Oh yeah, that's right. Sorry. The upper facial rejuvenation first.
Yes.
And then the lower facial rejuvenation next. And when I do the upper part, I do brow, blephs, mid-face, all once.
Yeah.
And then go down later and do the face, neck, lip lift, whatever.
Right. I mean, if you do all of that together, that's a full deal. It's great. But yeah,
if you'll be here on Tuesday,
it's a big recovery.
We're doing facial implants, facelift, revision rhino. It's an extravaganza.
They're going to makeover.
Yeah, but
sure.
it's like everything's small, but it's a lot at one time. So it's going to be a big makeover, which can be done.
But if you're just doing the eyes, recovery for that, it's not bad. From a pain standpoint, if you're doing the brow, you're going to have a headache. It's going to be
for Dr. Vello, it's 2 days.
Yes, and you're back in surgery, no problem. Literally.
For anybody else, it's a week.
Everyone else,
a week to 10 days.
Some time off. You're going to have some swelling. You're going to have some bruising. Pain is really not bad. You may have some vision changes for 6 weeks. I think I had to wear glasses for 6 weeks because my eyes were just swollen. The muscles were swollen. They weren't quite working together in tandem. So it was just easier for me to use glasses and see than to try and get my contacts to coordinate with my muscles that were still really swollen.
Well, and also from the... when we do a transconjunctival lower lid bleph, you get a little bit of leakage of serum and proteinaceous fluid that can blur. I just tell people carry some tears with you, wash them out.
Right.
After about a week, that kind of goes away.
Yeah, you may have some dry eyes after a while. But that usually goes away. And we should say that for that blepharoplasty, that transconjunctival approach, that's an incision on the inside of the eyelid. So if you're not taking skin on the outside, the only incision you're going to have is going to be on the inside, on that inner part of the eyelid, so you don't even see it. But it can give you some problems, with some dry eyes and stuff like that. So dry eyes, some bruising, maybe some temporary vision changes while your swelling is still there. vision compromise, loss of vision, incredibly rare,
rare.
and unusual. That's just not a thing. But I would say probably most common complication long term would be dry eyes.
Yeah, I have dry eyes to start with, so
And
like
people
a
who
lot of
have
people
dry
do.
eyes,
Yeah, they're going to be dry.
They're going to have dry eyes afterwards as well. But if you're just doing the eyes, just doing the brow, it's a fairly straightforward recovery. You could be back to work if people don't have to see your face. If you can do virtual, you could be back to work in a week. If you have some bruising and some swelling, maybe give it a week or two. But and if you don't care what people think about you, you can be back to work in a week. It's fine.
There you go.
It's pretty simple.
I think that's kind of all the highlights.
That's it.
For our 101 series.
For our 101.
We'll get in the weeds in a
we'll
different
get in a little
one.
bit. We always do cost of a blepharoplasty.
Well,
In Beverly Hills.
In Beverly
Beverly
Hills
Hills.
today, if I do, because I don't do just blepharoplasty. So like if I'm doing a 4-lid bleph and a brow and a mid-face, that's a lot.
That's a lot.
That's a lot.
It's a big number.
That's a number I don't even want to say on here because somebody's gonna be like, whereas if you're in Tulsa or something, then it's a lot less.
Right.
So
And so
it's a
the
lot.
price is going to vary depending on whether or not you're just doing uppers, if you're just
More
doing
expensive,
lowers.
but worth it.
That's what I say. But that's just
true.
my motto in life.
Well, I mean, but the thing is, do you want to I don't know, it's very, very challenging. You don't want to skimp on your plastic surgery, people. That's what I'm going to say.
You don't.
You don't.
You don't.
You don't want to skimp. You want to go to somebody that's tried and true, has lots of good results, and is going to get it right for you. And if things aren't right, they're going to work for you to get it right. So that's when you find out how good your surgeon is when there are problems. That's it. That's why people fly here to Beverly Hills to get this stuff done. We do a lot of it. But with that said, you can get it done anywhere, and you can get it done by people who are really competent, board-certified plastic surgeons and facial plastic surgeons who are extremely talented and can do a great job. It just happens to be expensive here. And for whatever reason, we do a lot of it. It's part of the deal.
Part of the deal. But if you need to know numbers, people, because people love to hear numbers, I would say simple quad bleph, 2 uppers, 2 lowers, no mid-face, no brow. You're looking at anything between average 10 to 15, 10 to 18,000. You're throwing in a brow, you're throwing in a mid-face. Dr. Conference making eyelids. I'm making faces.
That's not what I charge.
I know. I'm giving.
It's okay.
This
it's okay.
is
I'm just
a
saying.
national.
I know. I got it.
Broadcast.
Don't listen to me. I just work here. It's international.
It's international.
I know. We got some surgeon coming from Georgia to visit. He wants to do like a whole fellowship here. I was like, I can't do that.
Georgia the country, Georgia the state.
Tbilisi. The Georgia the country.
Georgia the country, international, worldwide.
Yes.
Mr. Worldwide.
No, you're on this podcast too. Don't look at me.
This is worldwide.
By the way, they don't tune in to listen to me. I'm going to tell you that right now. They're listening to you. They're happy that I'm here just to be like a wall to bounce the ball off of. So anyway, but yeah, blepharoplasty is expensive. In New York, that would probably be even more than that. Probably 20,000 in New York.
Throw a
in
brow.
Dallas, it's probably like 8 or 9. I don't know. I don't know what the prices are there.
If
you put the brow and the mid face into it, for me, that's probably about $35,000-$40,000.
Right. Start adding some tens of thousands to that.
And by the way, that's today. It's 2022. If you're listening to this in 2025, it's probably double or triple, or now it's $2 million because somebody's not got the reins on the inflation lately.
Yeah, inflation's a bitch.
It's hurting us badly.
Yeah.
So yeah, but it is expensive. Expect to pay for what you get. If you want to get a great result, you need to go to people that get great results. That's all. Wherever you are.
Yep. Do your homework. Let us know if you have any questions. But I think that's enough for blepharoplasty. We tried to keep it short and sweet.
It was pretty short.
It wasn't too bad. Sort of sweet.
It's yes, I think so. Well, anyway, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.